As the country commemorated Uganda Martyrs Day 2024, thousands of pilgrims at both Catholic and Protestant sites at Namugongo received health care and emergency services at different medical tents. A number of pilgrims were seen being carried to different tents after fainting. Others presented with back pains, hypertension, cough, flu, and others were referred to hospitals for further management.
So far we've seen about 160 patients, that is since morning. Most of them are presenting with back pain, muscle pain, stomach disorders. We have a lot of cough and flu and red eyes. We have also received a number of them who have collapsed. So our tent has been acting as an emergency stabilizing facility before dispatch to the nearby facilities and Mulago. I think to the pilgrims, especially those with chronic diseases like hypertension, diabetes, they need to carry along their medication so as to mitigate sudden collapse and unmanaged high blood pressures. Otherwise, the arrangement of having medical coverage on site is good.
For us here in our tent, as Kisubi Hospital, we have not registered any case of red eyes. Yeah, but we've had cases of diarrhea, we've had cases of ulcers, stroke or gastritis, we've had cases of headache, stroke migraine, we've had cases of fainting, we've had cases of fatigue, we've had cases of myalgia or muscle pain. To the pilgrims is that let's make sure that we have something to eat, because I believe many people have not had anything to eat, and we may register many more cases of hypoglycemia or fainting because of low blood sugars. Yeah, and also urge those ones who have walked long distances to find some places where they can rest so that their body can recover to normal, because it has been overworked and the physiological functioning has been compromised.
Mostly come as a result of fatigue, congestion, lack of enough supply of oxygen down the congregation, most especially the students from schools and the elderly who cannot stand for long, and as a result they collapse. But our volunteers are distributed at different points, and they bring these people on stretchers. We try them, we work on them. As for the students, you realize that they are not used maybe because of such a weather, they are not used of standing, they are not used of, probably they came without having breakfast, they collapse.
The elderly and school-going children who are most affected sought medical services, as health experts advised schools to take students before the D-Day to avoid fatalities.